It's time now for Down on the Corner with Dale Hoffman, North Central Arkansas's premier news talk program. Brought to you by Sears Hometown Store, locally owned and operated right here in Mountain Home.
Good morning, North Central Arkansas, Southern Missouri. It is Tuesday, September 29th, 2020 at 7 a.m.
It's a nice chilly morning, and I love it.
Yeah.
It was 43 when I left the house. 43
Well, it's 48 here right now. Well, at the airport.
I love it. I'll take it any day.
Camping weather.
Any day.
With 1 foot sticking out of the tent, right?
There you go. I like the cooler weather. I just do.
It's yeah. Well, you know, the lower humidity, lower temperature, you know,
Well, you're going to complain it's too hot or too cold.
No,
or
this
you're
is,
just...
windows are open, attic fan going, you know, it's perfect weather. You feeling boxed in here, Scooter?
Always.
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 You'll be glad when we get rid of the boxes.
Brady Bunch.
The Brady Bunch.
Huh?
I heard the Brady Bunch come on. That is,
Classic.
Here, he's going to say something about it. We're going to put him up.
There you go.
Now that's
Here's
the Brady Bunch.
Here's the story.
Of a guy named Dale. I love it, though, guys. It looks great.
Yeah, we've got him up as high as 58 inputs over here, so he's got 58 little boxes to look at to get on it to preset.
Actually, I'm just going to put him on and leave him on. Here you go.
Oh, no.
And your co-host is Tobias Pugsley. Yay! The crowd goes wild. Flashbulbs in every direction.
Oh, it's just good to be back with you guys.
Yeah, it is. Good to see you.
Yeah.
It's always a lot of fun.
Absolutely.
Wow.
I like the boxes, though.
You like that, huh?
Yeah.
Yeah.
I just don't know how Scooter keeps them all straight.
58 inputs. Actually, yeah, that's what I'm running.
58 today?
58 today, yeah.
Wow.
Wasn't as bad as Bob the other day, and he had different people calling in on top of this, on top of that, and that was a lot of boxes.
Oh, man.
I'm all right. I'm good.
He's good. Dead on Corner is brought to you by your hometown Sears store at 1029 Highway 62 East. You can call them at 870-425-3191. The very best in home appliances, home entertainment, tools, lawn care equipment, and anything you really need. Go to Sears. Locally owned and operated. You spend your money here. The money's invested here. You got hometown folks serving hometown folks right here. We will invite other people in from Ozark County and Howell County, Missouri, and come on in from Marion County or Fulton County and visit your hometown Sears store. Jay and his staff, they've got the in-home repair. Remember repair shops?
Yeah.
Well, there you go. Hometown Sears store, right there in the graphics. Right
So,
there.
fun story about Sears.
Yeah.
So,
Ooh,
they
always
used to
like
have
stories.
used to have a little satellite store off of in Yellville.
Uh-huh.
My dad was the guy that would go in and install the things. You know, he'd work his regular job, and then in the evenings he'd go and install your dishwasher.
Yeah.
And it was yeah. So we grew up with Sears and the catalog. Remember the catalogs?
I've unloaded many of them off the truck.
I
Yes.
mean, that was Christmas. I mean, I
Oh,
remember being a
yeah.
kid just circling all them things from Sears.
Race
that you
car
want.
sets,
Oh,
train
yeah.
sets,
Oh, yeah.
Shoes.
That
You
was
get
a
shoes
tradition in
from
my
Sears
family.
back in the day.
Oh, yeah.
Kids will never know that. You know, now
No.
they just get online.
When we were down at Main Street, down there right across from on 3rd Street where O'Reilly's Automotive is, we had a truck come in one time. This is when it was a catalog sales office. And a truck pulls in from Dexter, Missouri, and I knew what was on the truck. I said, what's the chicken farmer from Dexter, Missouri doing here? He says, well, I got a load of catalogs. He says, I was dead heading back to Dexter, and they hired me to bring catalogs down. We had 10 pallets of catalogs, and each pallet had like 25 bundles. We unloaded almost 17,000 catalogs that day.
That'll break your back.
It took us a while, let me tell you. I felt that one for 3 or 4 days.
I bet.
Some things haven't changed, though. They still go and install microwaves and still
They've got the
install your
service. It's still there.
appliances. Oh, yeah.
Husqvarna lawn care equipment, Craftsman tools, the warranty on Craftsman tools. He's a Husqvarna fan. He's got 18 of these things, you know.
I am a Husqvarna fan.
Yeah.
I like their big mowers, their commercial mowers. They're nice.
That's good.
Yeah.
So your hometown Sears store, I mean, you've got your maintenance agreements, you've got your in-home repair. And then if you can't bring it in, they can come to the home and service it, you know. And so, I mean,
They can go
it's a
mobile.
win-win situation when you talk about your hometown Sears store right here in Mountain Home. Locally owned and operated, 425-3191, 1029 Highway 62 East. That's up on the hill behind Wendy's. Same parking lot as Orscheln's out in front of Physical Therapy Connection. Your hometown Sears store, locally owned and operated. I'm enjoying Brewed Awakening coffee. You can do the same thing. 3 locations to serve you. We have, of course, Baxter Regional Lobby, and follow the rules and regulations for the COVID-19 directives there. I'm sure the volunteers there will advise you there. Then you have Bomber Boulevard, 62 East Plaza, the 2 drive-thrus. Bomber Boulevard at 704. Probably not as busy as it will be in about 20 to 30 minutes. And then, of course, 62 East Plaza by Anytime Fitness. The best coffee in town is Brewed Awakening. Talked to Mike the other day, and he says, I order beans, they roast them and send them. So within 24 hours, you can have the freshest roasted coffee beans in Mountain Home.
Have you ever tried their cold brew? That's my go-to.
Really?
Yeah. So Darby that works
Yeah.
at so we have our favorite baristas. Wow. Darby, she's my favorite. No offense to the others, but yeah, she serves up some mean cold brew every morning at the hospital.
Just read this going on TV. This is my favorite. I don't care about the others. I bet he goes around. This is my favorite kid. The rest of them will just push to the side.
Well,
No.
so I'm a big fan of loyalty, and there's been a little turnover there, and Darby's been with us from when I started, I think, really. So I'm loyal, Scooter.
There you go. I like that. That's a good thing.
Brewed Awakening Coffee, the best coffee in town, is Mike at Brewed Awakening. Says, we are real coffee, and they sure are. Check out their mochas, lattes, frappuccinos, and even pumpkin spice. I got a friend in Flippin' loves pumpkin spice. It works at Baxter Regional.
It's the season, Dale.
Tis the
people
season,
wait and camp out for pumpkin spice. I've never seen anything like it.
Yeah?
Yeah.
Well, I sent her a text one time. There was a thing in the service station that says, we have pumpkin spice motor oil. I'll take it.
And I bet you somebody bought some just because they thought there was some real pumpkin spice there.
That will make my engine smell a whole lot better.
Yeah, that tailpipe odor, it smells like pumpkin spice.
Orange smoke coming out.
Somebody's going to run with that business idea, Dale. I'll think you some royalties on that.
Brewed Awakening Coffee, the best coffee in town. If you're not drinking Brewed Awakening, you're just drinking muddy water. Roller Funeral Homes of Arkansas bring the morning prayer each and every day with all our respect. Roller Funeral Homes, 29 in the state to serve you, with one in Memphis, Tennessee. Excuse me, here in town. Talk to Bruce, Brad, Charlotte, Chris. Anyone out there can help you. There's some folks out there perhaps I haven't met yet. Roller Funeral Homes, with all our respect, that's how they do business on a daily basis. And when you lose a loved one, a friend, or whatever it is, what do I do? What do I do? Let them handle it. Caring, understanding, passionate. This is what they do. When we put with all our respect on the logo there, that's how they do business. With all our respect, Roller Funeral Homes. They bring you the morning prayer each and every day. So let's pause now for our morning prayer. Heavenly Father, well, I don't speak for or represent anyone but myself. I'll have to say I'm tired of all the political jabs, lies, half-truth, accusations, and so on. All I want is the truth. There's no constitutional mandate for presidential candidate to show his tax papers. One question I have is, how can ordinary people stay in Congress for 30-plus years and become multimillionaires? Where are those tax records? Political parties can battle it out. All I want is the truth from both parties. Scripture teaches us that we should remove the plank from our own eye before we complain about the speck in someone else's. Maybe our politicians need to read that. Lord, my prayer today is we need Jesus Christ to be in control, and I pray you heal our nation. It's my prayer today. Amen. Amen. Take two. Roller Funeral Homes of Arkansas. Bring the morning prayer each and every day with all our respect. Roller Funeral Homes.
And now,
hold it. Brace yourself.
Dun, dun, dun.
Told you.
The weather.
He's been practicing.
He could have. Tobias could do a better job. He could probably.
Just goes dun dun dun.
Well,
yeah, just trumpet.
Okay, so you had a drum roll or anything? Dun dun dun!
Listen to this. Come on.
I'm keeping that on recording.
Let's see. I'll drop a quick.
We'll play it back every time.
Here, I got a contract for you right here.
I'm gonna get 10 cents every time you play that.
There you go.
We'll rebid at 6.5.
There you go.
Morning weather brought to you by the Z-Team. Bob and Linda's the door for all your real estate needs. 870-405-0793. They came in with the most prestigious Century 21 National Award. Not state, not local. The highest honor in the corporation. That
didn't surprise me one bit.
I mean, unbelievable.
Yeah. You know what's cool is we explain this. I don't know how many people, and you get the same answer. Doesn't shock me.
Yeah.
I mean, they're not shocked at all. I mean, they work hard for what they do. They really, really do, and they really are out to help people.
And they really are. Bob and Linda's the door of the Z-Team for all your real estate needs. 870-405-0793. RetireToArkansas.net is where we find Fog on the river today. Wow,
Oh,
look
that's
at the
my
clear
favorite
sky, though.
thing. I love the river cam, guys.
Isn't that
Oh
cool?
yeah, and then you got the fog mornings. You got sometimes where it's just starting to break through. I think that's really pretty.
Well, look at the sunrise coming in over Cotter. I mean, there's not a cloud in the sky. All the fog just ground level there at the river.
You need to go to their site and look at this when it's storming outside, and you watch all the lightning strikes all
Well,
around.
remember the funnel
It's
cloud that
really
went over
cool.
in the spring?
Yeah.
Watch the tornado go over.
That's awesome.
Wow. Yeah, you're looking from Marion County into Baxter County, and right in the center of the screen is actually the hill in Cotter out by the old water tower.
I'll put the still shot in. We've got a still shot, kind of give you an
that's
idea.
that's a
of what
late
you're looking
September, early October. Taken about 2 or 3 years ago. That's what it normally looks like about 4 in the afternoon, late part of daylight time.
at. And that's what it looks like now.
And that's what it looks like now. Beautiful sunrise, though. Look at that. You go to retiredarkansas.net and go to live webcam, and in the lower right-hand corner, there's a little camera icon. You can take pictures throughout the day and share it with friends, family, use it as a screensaver or backdrop. Bob and Linda Zadora, the Z-Team, the award-winning Z-Team, they're ready to serve you both in Arkansas and Missouri. And so the team is ready to go. Call them at 870-405-0793. You can check out all the listings at retiredarkansas.net, not only with the Z-Team, but everything at Century 21 Lemac Real Estate, and all multiple listing service numbers are on that website, both in Arkansas and Missouri. The Z-Team brings you the morning weather each and every day. The award-winning Z-Team, 48 degrees both in Mountain Home and Harrison, 49 in Batesville, 45 at Salem, 48 at Calico Rock, 44 at Flippin, 45 at Marshall, 45 at West Plains. Around the region, St. Louis at 49, 48 at Poplar Bluff, 44 in Springfield. You got to be kidding me. It's warmer in Watford City, North Dakota than here. 50. In contrast, I had family that used to work up there, and we do a contrast because we've been sitting
It's
here.
all right. They can have it. They can
55
have,
degrees here and minus 40 up there.
Yeah,
you
they
know,
can have
literally.
that one time that they're
Literally.
warmer,
I mean,
because we
unbelievable.
won't get to negative 40.
Yeah.
I'm good with that.
Where's that in relation to like Fargo?
The other end of the state, I
Other
think.
end?
Yeah, yeah. It's in the kind of the southwest part of,
Okay.
North Dakota. Watford City at 50. 2 degrees warmer up there. Wow.
It's probably a heat wave for them, huh?
Oh, yeah, swimming pool. Yeah, open the pools. On the radar, the rain that passed through a day or so ago is now from New Orleans up through Montgomery, Alabama, north of Atlanta. It's to the west of the Carolinas. Kind of skirts West Virginia up into Pennsylvania and Ohio, on up into Buffalo, New York, and on up into Canada. A little bit of shower activity in Minnesota to the that would be to the east of Fargo, North Dakota. And I'm not seeing much else going on. Take a look at Arkansas and check your highways there. 62 412 is clear. 65 going to Branson in good shape. Highway 67, 167 Little Rock to Searcy and Batesville where they split off. 67 goes on up into southern Missouri. Your interstates 30, 40, 49, 55, 555, and 530 in Arkansas clear at this time. Looks like we're in pretty good shape. I-40 at Memphis, to Jackson in good shape. Interstate 155 Dyersburg to Jackson looks good, as well as 412 across there. Southern Missouri, Highway 160, Highway 60, 65, 67, Highway 61, Interstate 55, 49, 29, 44, and 70. Look like they're in pretty good shape. East St. Louis, Illinois, east on 64, clear skies there, no rain. Interstate 57 from Carroll, Illinois on up towards Mount Vernon. Pretty good shape there too. Going to be nice traveling weather in the three-state area. No watches or warnings for Illinois, Missouri, Arkansas, Louisiana. Have some fog in northern Alabama and central Tennessee and middle part of Kentucky. Our 7-day forecast is beautiful. High temperatures this week, 70, 83, 71, 66, and 66. A little bit of cloud cover on Saturday, but we have a nice week in store for us. Checking I-Drive Arkansas, we have traffic moving good. A little bit of slow traffic at West Memphis, over here on I-40 at I-55 at 555. And that's about it there. Missouri Department of Transportation, Highway 201 and J are up and running, so you can use Highway 201 to go all the way up to Highway 160. They've completed that project. Bull Shoals Lake is sitting at 668.65. We're only 9.6 feet above the full pool of 659. We're almost back to normal there, or at the full pool, I should say. Norfolk Lake at 559.38. They're 7.38 feet above 552. And so get the lakes back down to normal and get the shorelines cleaned up. Our good old buddy, well, no, let's do this first. Allergy index, 4.4 today, 4.1 tomorrow. Ragweed and chinnopods are your culprits there. Them chinnopods, them little rascals.
At least the nettles are gone.
Yeah, that and the sagebrush, you know.
Well, sage I get, but nettles? Come on.
Arkansas Department of Health, our good old buddy COVID here. The state's showing 82,049 total cases with 73,573 recovered. That's an 89.6% recovery rate. Your 6-county area of Baxter, Marion, Searcy, Stone, Izard, and Fulton, we have active 296, recovered 1,035. And the total cumulative cases for the 6-county area reported at 1,350. That's a 76% recovery rate.
Click on the active map real quick. I haven't seen that map in a little while.
You miss it, don't you?
Well, it just kind of lets you know what's going on now.
Active 7142, active confirmed 6824, and this active probable 318. I love the probable deaths. You know, it's probable. You know. Anyway, crude oil price is sitting at 40.34, down just a little bit. The Dow Jones Industrial was on a pogo stick yesterday, and it finally finished up 410.10 at 27,584 as of 5:06 Eastern Time. And it shows the market is staying strong, 27,584.06. The weather, morning updates, and all the good stuff brought to you by the Z-Team. Bob and Linda Zadora for all your real estate needs. 870-405-0793. RetiredToArkansas.net. Tobias is here finally. Yay! After the break, we're going to talk to him. Be right back.
We got Stephanie, too.
Oh, and Stephanie's over here. Well, we've got to add her to the box.
She's way more important.
She will be in a box. We'll be right back.
With air holes.
Diatley Dental Care is a family-owned dental practice. Doctors Irvin and Christina Diatley grew up in the Twin Lakes area and are proud to serve the community. With modern treatment methods and state-of-the-art technology, they are dedicated to providing exemplary care to patients of all ages. Our compassionate team consistently receives training above and beyond the standard of care.
We're changing the way you see dentistry.
Come be a part of our dental family.
When you're out of town, make sure your pet is with someone who will love them as much as you do. At 201 Pet Salon and Resort, your pet is cared for just as they would be at home. 201 Pet Salon and Resort is the only all-suite climate-controlled and air-filtered boarding facility in the area with private and spacious rooms to keep your pet relaxed. And with over 3/4 of an acre of fenced play area, your pet will receive the proper exercise they deserve. 201 also offers professional grooming services. Your best friend is in good hands at 201 Pet Salon and Resort in Mountain Home.
Hi, we're Bob and Linda Zadora, the Z-Team at Century 21 Lemac Realty, and we'd like you to meet the rest of our team.
When you are working with the Z-Team, you will find that not only are they down-to-earth people, but they are trained professionals who work with downsizers, first-time homebuyers, and clients who may want to relocate to our beautiful Ozarks. Our team has agents who specialize in lake and river properties, listing and selling raw land, acreage, and all residential homes. Listing your property with the Z-Team will help get it sold with unmatched Century 21 global marketing. You can find out more at RetiredToArkansas.net. Take a step back in time when going to a barbershop meant more than just getting a haircut. Come into Legionnaire Barbershop today, a unique gentleman's barbershop. Get back in style with 2 experienced licensed barbers who are trained in tonsorial arts and lock removal and are happy to give you a straight razor shave. Legionnaire Barbershop is veteran-owned and operated and located at 1041 Highland Circle, Suite 55 in Mountain Home. For a full, old-fashioned barbershop experience, stop by Legionnaire Barbershop today.
It takes the right gear to survive out here. Oh, there she is, Ferris. It's the best gear around. Strong as an ox. Safe as houses. Out back, there's one powerful beast. awesome. Four-wheel suspension handles whatever Mother Nature throws at you. Designed to take the hard out of hard work and deliver all the power you could need. So if you want to tackle the great outdoors, get yourself a Ferris.
Get the only mower with suspension technology at Mower Warehouse in Mountain Home, where they accept mower trade-ins, have flexible financing options, and services all brands and models. That's Mower Warehouse, located on Buzzard Roost in Mountain Home.
$7:20, Tobias Pugsley is here, and I'm going to let you introduce our special guest today, Tobias.
Yeah, Dale, today with us we have Stephanie Free, our infection preventionist over at the hospital. As you know, it's been kind of crazy times with COVID-19, and that's why we've not been able to come over and do the show in person. So we're excited to be back.
Hallelujah. Love to
I
have
figured you guys would have lots of questions about COVID, so I brought the expert,
I've
Stephanie.
got one question. When is it going to be over?
I think that's the million-dollar question. That's what everybody's asking.
I make fun of it, and I'm just – anyway, I've got a cousin in Tyler, Texas. He's been through the paralysis state where they've had to actually paralyze him, put him on a ventilator to keep his lungs going. This is a guy that goes all over the world. He's an oil engineer. He gets calls from all the companies. He's been in, you name a country around the globe, he's been there working all. He is very, very ill with COVID.
Yeah.
And he is just as healthy as anybody on the face of the earth. And I mean, you could have the arch fall on you and not do as much damage as what's. It's serious.
And that's what we're saying, that
It's
some
serious.
people get it, and it's real bad. And then on the flip side of the coin, you've got people that get it that don't even present symptoms.
Yeah.
So it's a really interesting bug, a real interesting virus.
So for medical professionals, you've got two spectrums that you really don't know what to anticipate from anybody. So
you're right. I think that's what's been the interesting thing through this whole ordeal is people expect us to have all the answers. And they expect healthcare as an industry to have all the answers. And the reality is healthcare is learning and adapting and doing, sort of on the fly the best job that they can as they learn more. If you look back to March, April, it was all about stopping the spread, wearing the mask, social distancing, isolation, really trying to stay away from people. And the whole reason for that was to try to stop and slow that curve. The reason for that was so that we didn't overwhelm the healthcare system as a whole. Mm-hmm. Now, during that time, hospitals and healthcare organizations across the country were, rapidly developing protocols and studying the disease and doing all these things in preparation. So when you live in an area like Baxter County, we've had all this time to sort of study and watch and see what other healthcare institutions are doing across the country and take those best practices and bring it back here. Two of our physicians, we had several, but two of our physicians, Dr. Malty and Dr. Martin, when this first began, they actually went to New York and worked a couple weeks on the front lines in New York when it was really bad to study that and to bring that back to treat patients here. And so we went a long time, without a case in the hospital. We went a long time without a death, fortunately. And now as Ron always says, the fog, he calls it the fog, as it got closer and closer. Well, now it's here. Now you can tell by our spike in cases that, COVID is here. It's present in Baxter County. It's present in the counties around us. And so now we've had a little bit of time for preparation and we feel like that we're adequately prepared. But the reality is the hospital capacity has a max.
Have you been overrun?
No. We've not even been close to being overrun so far. But there are hospitals, in Northwest Arkansas when they had their first spike.
Oh my goodness!
Talking to some of the professionals and the healthcare and the administrators over there, they were overran. And that's the fear is you get into flu season, as you get into cold season, we don't want to scare people, but that's the concern is every time you get a sniffle, what do you think it is now? Well, I got COVID. And so now, as though we get into that season, it's going to become really interesting. So we really work hard as an organization to prepare. We've done,
so you're saying there's been so much research right here in Baxter County just to combat
Well, I mean, research into, what drugs are working. The first thing you heard about the hydroxychloroquine, and then it was the remdesivir, and then it was plasma, So we follow those, and Stephanie, I'm going to let her talk more because she can talk way more intelligently than I can. I've just kind of got to be a spectator through all this. As trying to figure out how we can properly communicate to the public. Because here's the deal. We want to be transparent. We want that level of transparency. As much as we can within the law be transparent with you as a community, we're going to do that. And so we've been watching and trying to keep the community, kind of in the know on what's been going on. We had plans that predated for a pandemic like this. That said where we would communicate those things. So we've been following that protocol, trying to keep, community in the know. But, Stephanie brought with her the latest numbers, and I would like for her to take a second to share those, just sort of where we are. She needs.
Now, Stephanie is an infection preventionist. Is that correct?
That's correct.
Yeah. And maybe you might want to tell them a little bit about what that is.
Wow.
Yeah, so infection prevention is very overarching. There's many things that we do in the world of infection prevention, one being getting prepared for anything that may rear its ugly head. A couple years ago it was Ebola, there's MERS, there's SARS, and then of course now we've got COVID. So trying to help make sure that we're following CDC guidelines, that we have those protocols in place to help combat that if we were to see it, make sure that we're prepared as a facility. Another big thing that we do in infection prevention, though, is healthcare associated infections.
Say that again.
Healthcare associated infections. So that's something that, say a patient comes into the facility with, they have a surgery, and then within a few days they may develop an infection from that surgical site. So that's something that we monitor, that we have to report many of those to the CDC, to NHSN is what we call it, National Healthcare Safety Network. And then that is actually information that is viewable by the public, and then that also affects our quality payment programs. And so that's a big part of what we do as well. We look at those, we report those, but then we also look at the data, see kind of what the trends are, and help with processes to improve those infections throughout the facility. So it's very overarching, and there's a lot more involved, of course, than just that. We look at construction jobs, to make sure that they're doing the right thing as far as barriers and negative pressure and all those things that you may hear within a healthcare facility, to help make sure that the dust and everything that they're doing on a construction site is not reaching the patients. Lots of education to staff, making sure that, especially right now through these times, that we have enough personal protective equipment. So it's a very broad role. I never knew that when I started infection prevention that I would have to know HVAC systems and negative pressure and positive pressure and all of those things. But yeah, it's very challenging and very rewarding. Never a boring day in the world of infection prevention.
I want to ask you a question with all due respect. Scooter coaches wrestling. We get to ping-ponging this back and forth. You can wrestle, but you can't shake hands afterwards.
Right. Yeah, that does seem a very
Like,
different,
really?
Yeah, that doesn't make much sense, does it? So yeah, and really that close contact, what they're finding is that they don't think it's quite as transmissible through contact of surfaces and everything. It's actually more face-to-face contact, and that's why masks really do make a difference.
Here's the dumbest question you're ever going to be asked in your life.
We've had some doozies through this, Dale. I'm probably not.
I mean, I've not even had a sniffle. Knock on wood, I haven't had a sniffle this year with all the COVID, and I've gone about my usual stuff. But an antiseptic mouthwash, will that help knock out the germs? It says kills 99% of all bacteria. Is that, because I drink a lot of coffee and I'm around a lot of people, so I don't want coffee breath all day long.
Right. I think it might definitely help, but especially with the bacteria in your mouth, but I don't know that per se that's going to help fight COVID. I think more of what we're seeing with COVID is it's going to get in the nasal passages, any of the mucous membrane, so it can get into your eyes, your nose, or your mouth. So of course it might help reduce some of the bacteria or viruses in your mouth per se, But there's other ways that you can get COVID, like I said, through your eyes, through your
But now,
nose.
what about through a vitamin regimen? You know, they always say, well, take vitamin C, you won't get the common cold.
Right. Well, and I mean, it definitely helps to boost your immunity. I don't think it's going to prevent COVID, but it might help lessen the severity of COVID if you definitely have those vitamins. I think they say vitamin C, vitamin D, and zinc are some of the things that I've heard.
About the zinc.
So, I mean,
Now,
it definitely...
how does that fit into the picture with the zinc?
I honestly don't know the technicalities around it, but I do know it's just basically an immune booster. And so the combination of all three of those things is going to help boost your immunity and help you fight COVID if you were to get it. So.
Really?
Yeah. So do you want to kind of...
This is, y'all have been dealt, I mean, this is a curveball that you can't, I mean, you know, how do you deal with stuff like this?
So let's look back for a minute.
All right.
So, and this is something that it frustrates me personally. But so we look at January, February, and March. And, you know, I'm in marketing, so one of the big things that we work on in my department is the growth of the organization. So we want Baxter Regional to be big so that we can be comprehensive. So we're always looking at expanding our footprint and growing. So January through March, Baxter Regional is having the best first 3 months we've ever had as an organization. We are rocking and rolling. Things are great. We are growing. We're expanding our footprint. Then we start hearing about COVID. And literally, guys, we see in April and May the bottom drop out. We lost, I don't even want to tell you how many million in just over the course of a couple months. I mean, thank goodness for the CARES Act. We would have been in some real trouble.
Yeah.
And still, you know, still fighting every day to make sure that we're not in real trouble. Thank goodness we've got great leadership over there.
A lot of the what they call the surgeries,
all the elective surgeries.
Yeah, that's it.
And you know, and so it really changed everything. Then, so the bottom drops out. We have to end up furloughing some staff. We have to end up making some cutbacks. We cut expenses. We do everything we can to be as fiscally lean as possible. Then they resume elective surgeries. Things start coming back. We start bringing people back, and now everything's just different. You know, right now you come in, we require you to wear a mask in our facility. It's just part of the safety. You've got to wear one. Well, what does that do whenever a big part of what we do is our smiling faces and the interactions that you have with our nurses and our doctors? I mean, our personalities and that interaction, that's kind of what sets us apart, really, I think. And when they can't see your face, everybody, in my opinion, with a mask on looks mad. Mm-hmm. They look angry. And so imagine when you got nurses and doctors coming in with the mask on, which they're used to that, but everybody looks so mad. Now the person bringing your tray's got a mask on. They look mad. So what we're trying to think outside the box, and we're always looking at things. But we've had to do things like, you see the little picture here? I don't just like to wear a picture of myself around around my neck.
Badge.
Of course, I photoshopped mine a little bit. You know, I look a little skinny and nice. Anyways, but we do that so that when we have our mask on, those patients can see what we look like, that we're smiling without a mask. And we try to remind them, hey, underneath this mask, there's a smiling face.
So you don't like it any better than we do?
Oh, no. I mean, nobody likes the mask. I mentor some high school kids, and we went around. I said, you know, what's one thing you dislike the most about this? And every kid said the mask. I mean,
I was going into a business establishment the other day, and this guy had a black mask on. He had round black sunglasses and a round hoodie, or put a hoodie on. I thought, I'm going to wait outside. Is he COVID or is he?
That's just kind of the natural, the look now. It's the fashion season of masks.
How'd you like to be a banker with somebody looking like that?
I'd be a little concerned. I guess that's why their lobbies are still closed.
We need to take a break. 7:34. Tobias is here with Stephanie. We're going to be right back for Baxter Regional. Take a break. Be right back.
Jim Brown Company keeps you cool when it's hot and warm when it's not. A trusted name in the mountain home community, Jim Brown Company provides timely heating and cooling installation and repairs. Our certified technicians incorporate new technology on every job to provide you with the most advanced services. At our metal fabrication shop, we handle projects big and small. We've created everything from commercial ducts to custom designs.
I'd recommend Jim Brown Company to my friends and neighbors. The reason being they have high-tech equipment. Their service techs are well qualified for the job that they do, and they also send me a report after all the work is done so I know exactly what my unit's doing.
By visiting our showroom, you can learn all about our heating and cooling products. We'll educate you on your options and help you decide on the right solution. For total comfort at your home or business, choose Jim Brown Company. Quality service with a family name since 1964. Driftwood Lanes. Fun happens here.
At Connor Family Funeral Home, our goal is to provide our friends and neighbors with caring, compassionate services at an affordable price. Connor Family is a full-service funeral home that offers a wide range of services to meet your family's needs and customs. We are the first on-site crematory in the area and provide many options to memorialize your loved ones and address all the details for a more personalized service. Where compassion and affordability meet, Connor Family Funeral Home in Mountain Home.
When you think about Hospice of the Ozarks, it's our desire that you think about finding a way to live your life to the fullest while living with a serious illness. If you ever need help and support, we provide a team of healthcare professionals and volunteers that will support your physical, emotional, and spiritual aspects of life while doing the same for your family and caregivers in the comfort of your own home or wherever you call home. When you think about Hospice of the Ozarks, we hope that you grant us permission to walk on the journey with you. Your not-for-profit option since 1979.
When I grow up, I want to save lives, like a superhero, and show up when people needed me.
When I grow up, I want to do animations. I want to create characters that can fly.
No matter what it is you want out of life, there is a path to get there.
When I grow up, I don't know what I want to do when I grow up, but I know I want to go to college.
Arkansas State University Mountain Home. Take your first step at asumh.edu.
At Letty's Mexican Restaurant, we are here to keep you safe during these difficult times, as well as serve you the best Mexican food in the area. That's why we have installed a convenient drive-through window for all your to-go and pick-up orders. Give us a call at 870-435-2532 to order your next meal, whether it's breakfast, lunch, or dinner, and ask us about our daily specials for a low price to feed the whole family. Experience the best in Mexican cuisine. Letty's in Gassville.
.38, Tobias and Stephanie here from Baxter Regional Medical Center. Tobias, we're going to go over some numbers, I believe. Is what you need to do now?
Yeah.
Okay.
Stephanie will give you sort of the latest numbers on what's sort of happening.
Yeah, so at Baxter Regional Medical Center, now this is as of yesterday morning, we had tested 6,214 individuals total since the beginning of the pandemic. And we have had 222 positives. And let me just say, really, most of these positives have really come probably in the last month. It really hasn't been very big in this area up until
then. That was
then.
222?
222. This is as of yesterday. Haven't had a chance to update the numbers this morning.
That's a low percentage.
Right.
That's good.
Right. And keep in mind, too, we service a huge area. So this wouldn't just be Baxter County. This is Fulton County, up into Missouri, Marion County, all of the surrounding counties that we're testing. So this is a huge span of individuals. And of those, we've had 35 admissions. And we have had about 2 or 3 patients that have been readmitted, so those are counted in those numbers. We have had 7 deaths, unfortunately. And I know, too, on the map, I just want to reiterate that it only shows 2 deaths to Baxter County. So the way that those deaths work is it's according to the patient's residence. So if they live in Marion County, it will be a death for Marion County. It won't be a death for Baxter County. So that's why those numbers are a little bit skewed from what we're reporting. And also, what they have informed us is We report daily our inpatients that we have for COVID and if they've died, et cetera. They look at that information, but they will not report that as a death until they have received the death certificate in vital records in
That's
Little
where
Rock.
probable comes in.
Well, the probable is actually what that's referring to is there's different types of testing out there now.
Really?
So there's what's called an antigen test and a PCR test. And of course, the PCR test is your gold standard, so that's going to be your most accurate. The antigen test is a really quick 15-minute test, but what they're finding is that sometimes there are false negatives with that antigen test. So that antigen test, if it comes back positive, though, it's positive. We don't check it with our PCR. If it's negative, we do verify that with our PCR test to make sure that it is indeed negative. And we have had some that have been antigen negative and PCR positive. So what that probable means is that it's an antigen test that has come back positive. It's not the PCR that's come back positive. So that's the difference there between probable versus confirmed. Confirmed is PCR, probable is antigen test. So that's the difference. For whatever reason, they're not counting those as confirmed. They're counting them as probable. We currently have 7 patients in our hospital with COVID, and we do have 2 on the ventilator right now. So. And 2, what we're finding is that a lot of these patients, they come in, for example, to our emergency room, or they get tested as an outpatient, and they test positive, and then it's really in their second week of illness that they become the sickest, and then a lot of them have to come back and get admitted to the hospital.
Huh.
So really the first week is pretty mild, and then when you're going to get your sickest is usually in the second week of your illness. So that's been pretty common.
For people that come in with unrelated COVID, I was doing some breaks the other day. Let's say I kind of cut my arm. Okay. If I let it go, got a little infection, say I had to go see a doctor, is it mandatory I have to have a COVID test because I cut my arm?
No. So really the only thing we're testing for is pre-surgery. That's mandatory. Yeah. Everything else basically.
Well, I can understand that.
Right.
Sure,
so
yeah.
Everything else pretty much, I mean, if you come into our emergency room and you don't have anything that's reflective of COVID at all, no symptoms, then you will not get tested for COVID. You really have to have the classic COVID symptoms before they're going to test you for COVID. So not everyone's getting tested.
So what are the different symptoms? What are we looking for? I mean, I'm almost, kind of afraid to walk out the door.
Yeah, it's very broad. I mean, really, it can be almost anything at this point. You know, they're even finding some individuals will have not the fever, shortness of breath, or cough, but they'll have nausea, vomiting, diarrhea. Those are even symptoms, and it really ranges. I mean, there's some people that may not even show symptoms. There's some people that may just have a runny nose and think, oh, all I have is allergies. And then there's the classic, oh, I have fever, shortness of breath, and cough. So it really has been very broad in the symptoms, and it can be anything at this point.
One that's usually a really good indicator is that loss of taste and smell.
Yes.
That if you, and I'm not talking about like not being able to smell, cooking fried chicken or something. I'm talking about these people are almost sticking perfume up their nose and can smell nothing.
Are you kidding?
No. And that that's usually a pretty good.
So I've heard that from a few people. One person was cooking something that would smelled up the house normally, and they held it up to their nose and could not smell a thing, and that's when they went and got tested.
Good time to do turnips then, wouldn't it?
And that so you guys bring up a really good point, because I think that's been a real confusing part of this whole thing has been testing. So whenever this whole thing started, I'm just going to be real honest with you. It's been difficult to get testing. Thank goodness we have a great lab and a great lab staff that have realized that we couldn't put all of our eggs in one basket, that we had to go and try to find multiple forms of testing to be able to take care of our patient population. But testing's been really difficult. So Stephanie just did a really good job of explaining the difference in the antigen and the PCR testing. But, I think the misconception and what's been confusing is people think, well, I've got a runny nose, or I can't smell fried chicken, I'm going to go to the hospital getting tested. And that's not the best way, because you're going to come to and maybe call the ER, and the ER is going to say what's going on, and you're going to say, well, I can't smell fried chicken, or I have a runny nose, and they're going to say, well, you need to go home and isolate yourself, because that was the protocol. That's what they were told to do. Your best places for testing are the Arkansas Department of Health. And if you go on the website, and look at testing facilities, Baxter Regional wasn't even listed in the beginning as a testing facility. It's Arkansas Department of Health. Baxter County has one, Marion County has one. They do testing there. Your next option is your primary care physician. So my primary care example here in Mountain Home, I would call that office, let them know, hey, I'm presenting some symptoms. Do I need to get tested? And let that primary care, let your doctor that sees you on a regular basis make that determination. Because if you get bad enough and your primary care physician thinks you need to be tested, then they will send you to the hospital or send you to a location to get tested. And then, it expedites that process just a little bit more. But I think the frustrating thing on our end, because we keep trying to communicate it, but it keeps getting sort of lost in translation, is if you don't just come to the hospital because you think you've got a symptom, that's actually, we want to try to keep, those away and direct those to the right places. I also think MedExpress is doing cash pay testing as well. But I know that most of the tests are 3 to 5 day turnaround. The other thing I think there's a big misconception I'm going to let Stephanie talk about is people think, oh, I was around somebody that just tested positive yesterday, I need to go get tested right away. And that's not the case, is it, Stephanie?
No. So, if you know that you've been exposed to an individual, it's going to take a few days at least for you to incubate that virus and then have enough viral load that you would even test positive from COVID. So if you were exposed, say, on Friday, do not go and try to get tested on Saturday. It's not going to do you any good. It's really a waste because you are not going to have a viral load to even test positive. Really, what we recommend is waiting 6 days from the day of exposure if you don't have symptoms. Now, if you start to show symptoms sooner than 6 days, then of course, then at that point you probably do have enough viral load that you would test positive. So if you started to show symptoms prior to 6 days, then yes, go get tested. But if you don't have symptoms, wait at least 6 days. The average incubation period for this virus is 5 days. So that's why we recommend day 6. On day 6, though, here's the kicker. So even if you test negative on day 6, that doesn't mean, oh, I'm free and clear, I'm not going to get COVID. That's why you follow a 14-day window, because you can potentially get the virus maybe on day 10, day 11. You may still be incubating that virus and still not test positive on day 6. So if you have a negative test following exposure, you still need to quarantine for the full 14 days. That's very important. That's my worry, is that people have that false sense of security when they get that negative test and think they're okay. They go out and about and start spreading COVID to other people. So we have to make sure that people understand that you still have to quarantine for the full 14 days following an exposure.
Wow. Sounds like a good time to take a break.
Yeah.
Be right back.
That'll work. Be right back.
Did you know when you shop at Sears Hometown Stores, you are supporting your local community? That's right. Your local Sears Hometown Store is locally owned and operated by one of your neighbors. Their store offers the best of what Sears has to offer with the top brands and appliances, tools, and lawn and garden. They also offer great financing options that work no matter what you need. Remember to stop by your local Sears Hometown Store today and support a local member of your community.
Have you ever noticed every time you wash your car, you end up wetter than the actual car? Next time, run down to Car Care and let the friendly staff put a smile on your face. Car Care of Mountain Home has a variety of services to clean your vehicle's needs, inside and out. From a simple wash and shine to their outstanding detail services. Located 1525 Highway 62 East in Mountain Home. Stop by Car Care Mountain Home today, because driving a clean car always makes you feel good.
Hi, I'm Benny with Ammo Dump.
At Ammo Dump, they carry new and used firearms, large supply of shotguns, rifles, and handguns. Ammo Dump will buy, sell, or trade in your item and can special order whatever you like. They also have knives, scopes, ammo of any caliber, and provide gun cleaning and restoration. Call them today for the best competitive pricing around.
If I don't have it or can't get it because they don't make it, come and see us.
That's Ammo Dump, located next to Woodman's Package in Norfolk.
At MSI, they're not just another trash service. They're your friendly, family-owned and operated trash service, providing residential, commercial, and roll-off pickup. MSI offers competitive rates and services 5 counties in the north central Arkansas area. Various dumpster sizes available for commercial and accommodating you with weekly pickup for your convenience. Call Tammy or Kathy today at MSI. MSI Trash Service, small enough to know you and large enough to service you.
7:50, continuing program with Tobias and Stephanie from Baxter Regional. What do we need to cover now, everybody?
Yeah, so we were talking about testing. So tomorrow at the fairgrounds from 10 a.m. to 2 p.m., we're doing another partnership community-wide testing event with UAMS. If you guys might have seen, a few weeks ago, they were here, and they had 200 tests. And about 12 o'clock in the afternoon, we shut it down because we were out of tests. That was all they brought with them. That's about all they have the capacity to test in that window. So they're bringing another 200 tests up. It'll be at the fairgrounds. We had people start getting in line. It was probably about 8 o'clock that morning. Yeah, and but it's a great partnership. Actually, it's ran through the county. David Stoltz, our OEM director. I'm sure you guys have met him. Does a wonderful job leading those efforts. We just help support him, screening people, screening the people that do the testing, helping supply some nurses and folks to work that. The other interesting thing about this one is they are going to do flu shots too. So you have to get a COVID test, but if you come and get a COVID test and also want a flu shot, you can get a twofer, and everything's free. And that's all done by UAMS.
Wow.
And that's one of the kind of neat things through this. Probably you wouldn't have seen us historically maybe inviting UAMS up to do something like this on the scale for us, but this whole COVID thing has really strengthened partnerships and stuff like that.
Yeah.
Through this. So we're really happy to work with UAMS on this. And then last time, the 200, there was about a 10% positivity rate. Which is the lady that was running it from the clinical side guessed. She goes, I bet if about 10% of the people that showed up today were positive, if I was guessing. She was spot on.
Really?
Yeah, and so we'll have that again tomorrow at the Baxter County Fairgrounds.
Open to the public?
Yeah, open to the public. They do say bring your phone. If you don't have a smartphone, it's okay. They've got other arenas, but you're going to have to register while you're in the line going up to the testing part, and then you'll pull up under a tent and they'll ask you some questions, and then they pull you over. And have you all had the COVID test yet?
I have not.
Oh, just wait, fellers. I'm telling you. You want to know how much brain you've got back there. They're gonna stick that thing back there and make sure there's some back there, I promise you. And I've got a great tip. I've been tested twice, and this is the best tip I can give anybody from a seasoned veteran. Close your eyes. Do not look at the swab. Just close your eyes, tilt your head back, and relax.
Yeah, right.
I promise you it goes way better.
It's funny because my son did, and to see the reactions. Of course, my son's watching the whole thing, And at first, he's like, "This ain't bad. It kickles." Yeah. And then he's like, "Oh wait, no, don't anybody do this. Don't." You saw it all change. I mean, all that starts to disappear.
Yeah, and halfway you're okay. Once they get all the way back, but it's really not that bad. I mean, I think people make it out to be a little worse than it is, but it does burn a little bit. But they've got to get all the way back there. They want to make sure that they're back there, getting an accurate test and. But testing is something that continues to be, something we continue to work hard. Like I said, we've got one of the best labs, I feel like, in the state. They have done just a tremendous job reaching out and taking every possible avenue.
Don't you know that they've looked under every rock for an answer?
Oh, yeah. I mean, Ron's even had to work with our legislators to help push on that side for testing,
really,
supplies and capabilities. I mean, we've pulled out all the stops, and they've just done a great job. I'm also trying to make up because you remember the show I had on, and I called them vampires. I'm still trying to make up for that.
You got in trouble.
I got in trouble on that.
I remember that.
No, but we do seriously, guys. We do have a great lab, and without them, we would have been in some serious trouble. They've just done a great job. Stephanie's done a great job, help sort of lead us through this. Also, Shannon Noctegal, who sort of leads our coronavirus task force. We do meet daily and discuss, what we have going on in the hospital with the patients. We discuss any safety issues around that. We're starting to have discussions about what the vaccine rollout's going to look like. We understand there are going to be some parameters around how cold the vaccine has to be kept. So like I'm saying, we're always watching, trying to stay on top of it, in front of it. So now we're starting to figure out what kind of coolers or what kind of equipment will we need to be able to distribute that. What does the vaccine distribution look like? They'll give us the guidelines as far as what the order is on who gets what. But we're already starting to look at that. Bozeman was here and said he really expects there to be a vaccine after the first of the year. It's hard to believe anything you read on the news, so that's probably the most accurate person that we've talked to personally. But that'll be, the vaccine will be interesting. I think you'll have people that want it. I think you'll have people that say there's no way that I'm taking a vaccine that came out that fast. They'll want to let other people to try it first. So it's going to be a real interesting year for us. But we want our community to feel that we're on top of this. We want them to know that we're doing everything in our power.
Baxter Regional, you got the lab, you got Stephanie over here. Who a year ago would you ever think you'd be doing research and studies like this?
No. Probably would have been out of this job if I'd known. No, I'm just joking. No, I'm joking. But yeah, it's been a challenge. Like I said, especially at the beginning, as we were looking at the protocols and changing the policies, it was almost on a daily basis things were changing. It was just crazy, and as Tobias spoke of, that's really why they tried to slow the spread, is because so healthcare facilities could get prepared, because it hit us like that. March 11th, I remember the day, first case in Arkansas, and it was like, oh no, here we go, and it was just every day trying to look at the new guidelines and where the travel restrictions were, and that was changing. And I know the staff, kudos to them for sticking in with us, and still things are changing, not as often as they were, but trying to make sure we had personal protective equipment, getting all of that together, because that was really hard to get. So it has really been a challenge, and everyone has done a great job. I keep saying, it takes a village to get through this, and I think we've got one awesome village.
Well, you've got good, with the notes I've taken here, 6,214 tested with 222 positive. Now that's an impressive percentage. That's a very low percentage.
Right, and like I said, most of those have really hit in the last month. They're forever. Really? We never even had a positive case. So, and it's really, really picked up probably in the last month.
Keep talking. I'm going to run these numbers real quick here. 222 and divide that by 6,214.
Oh, he's doing math, folks.
I'm showing 0.0357%. That's some low numbers.
It is. And, Dale, also our physicians, you'll be hard-pressed to find a group of folks that care more about their patients than our physicians. And they've been involved in this process, making sure that as we do reopen service lines, because everything's back to being reopened, but as we've done that it's safe. Yeah. We want to be able to take care of COVID patients, and we want to be able to make sure their needs are attended to, that they're getting the appropriate level of care. But then we also have this other area of patients, the broken arms, the cuts, the surgeries, and we've got to make sure it's safe for those patients. And I feel like our physicians, our staff, everybody's done just a wonderful job of.
Well, I think y'all are going to beat this in our area, and it will go away. It's not going to be forever, never. We're not going to eliminate it, but it's not going to be this 6,000, 7,000 population of COVID. You know what I'm saying?
We sure hope so. If everybody will continue to follow the guidelines and do what they're supposed to do, I think we'll be okay. But we just appreciate all the support. When this all launched, we had donors step up right away and help us purchase, extra ventilators, UV lights. We've got a wonderful community, Dale.
Oh, yeah. Well, we got a wonderful hospital, too.
Giving community that loves their hospital and that wants to support us. And honestly, we had people making masks. We couldn't ask for more support from this community. I wouldn't want to live anywhere else in America right now.
Wow. 30 seconds, final thoughts. Stephanie, Tobias, thanks for being here, by the way.
Thank you. Thanks for having me.
A lot of information, though.
Yeah, a lot of info. And just tomorrow, again, is a community-wide testing event. We want people to, if you feel like you want to be tested, they will test anybody that comes. But you got to be one of the first 200, because that's all the tests are bringing. So we don't want anybody to be left out.
Scooter? your thoughts? You're off the
I'm good.
58
He's
inputs
covered
over
everything.
Go Bombers, man. Keep that good
There you
football
go.
podcast
There you go.
going, fellas.
I like your attitude.
Yes, sir.
Tobias and Stephanie from Baxter Regional Medical Center, thank you for being here. We got to go. We will see you tomorrow.